Hey guys, this is Mandy from the Hurwitz Center. I'm here today with Sarah Hall, who works down here in the spa with me, but also in the OR with Dr. Hurwitz. If you have been to our center, I'm sure that you have heard the term Morpheus. The Morpheus treatment is very groundbreaking technology that we use to tighten the skin on the face and the body. It can smooth out stretch marks and help to diminish scarring. It's a very popular treatment here in the spa, but the big news is we have recently upgraded to the Morpheus8. The Morpheus8 is very similar technology, except it's definitely more aggressive and it's deeper. We're actually treating the skin up to 8 millimeters deep, which is where Sarah comes in because they are also using it in the OR.
We're very excited about the Morpheus8. We can combine it with a lot of different procedures that we do here. We can use it as a single procedure. It's kind of like the icing on the cake. It helps with things on the face like fine lines, wrinkles, collagen stimulation. We can also use it on the body for stretch marks, acne scarring, scars. It is working really well. We're really excited about it.
That little twitch, right?
I got it.
We'll just leave the box
I'm
up.
sure you're used to it now.
Thank you. That first one.
Large.
So you're going to try not to go into the pink. So usually what I'll do is I'll come up to my pink in case I have to roll it, and then I roll it down like that. Thank you. That's okay. I'd rather big than small.
Sure.
I like my
Ready.
And it kicks back a decent amount, so you have to have enough pressure so it doesn't kick back.
Right, pressure is important.
Yeah, we want that kind of red, you know, the kind of uniform red appearance.
Yeah,
so we just keep going and making passes, correct?
Bleeding.
And you
So
push
we have
pretty
pink
firm.
Bleeding throughout.
Just push securely.
Yep, and he has good coverage on the tip.
Would you stay on the Bermuda border, or would you do the lips?
I would not go into the lips.
You would, but would you do the
don't wanna go
Bermuda
into
border?
it. I wouldn't go wherever it's pink.
Okay.
Start to get sore.
That's a sensitive area.
And what do we expect to happen here, Dr. Davila? What's our goal?
We're looking for some end pinpoint bleeding kind of throughout all the areas that we're treating.
And the goal result is
the late goal is neocollagen formation and some secondary skin tightening and improvement of the texture of the face.
And we're using what machine? Heather, speak to us.
Yeah, so this is the Morpheus platform. So it has the body handpiece, which is light blue, and then it also has the 24-pin handpiece. I won't just call it a face because really you can use it all over the body. And then it also has a multitude of heads now. So after doing this prime 12-pin, which we chose because we wanted to treat her periorbital area and perioral area, so it allows us to get close. We are going to use a resurfacing tip, which will address, it'll go down only 0.5 to 0.75 with the energy, and it'll help resurface the area also. So not only are we hoping to get some contraction, we're hoping to get some resurfacing in the skin.
And this is the latest technology
Yeah.
available only through Inmode, right?
Yes, this is an Inmode device.
You can see
And it's
how,
nice to be able to have the body. The body is a 40 pin, and it goes to 7 millimeters with energy being delivered down to 8 millimeters.
And we were providing this at the Hurwitz Center rather exclusively in this region, right, Heather?
Yes, yes. This is one of the first body tight handpiece, Morpheus 8 body handpieces in the area.
so you can see how when the radio frequency energy is delivered, there's a little twitch of the muscle. For example, the mentalis muscles or the depressor anguli oris. And it does a little beep.
I kind of like that.
I was just gonna ask.
Yeah. Yeah, it doesn't.
So-
It doesn't love the moisture, right?
Right. Yep, and I think that's a good amount of passes there.
Okay.
Say that again. What
So-
about passes?
So how long? I think we were only here for about 3-4 minutes, and so we were able to do 100 passes in 3-4 minutes. And you're saying that over the course of 3 treatments for a whole face, you're expecting in the thousands, right?
Yes,
of
for a whole face to neck, you would be around 1,000 to 1,400 pulses.
pulses.
So how many? So we delivered 115 pulses.
Just in this area.
Yes, and we're at 25. So let's go down to
25
20.
energy. I do like 8 and 10 around the eyes.
Okay. What does our guide say here?
So our guides.
So we are using the Morpheus Prime at
I
a
do
2
like
millimeter
this small
level.
tip. This is really nice.
Makes you feel like you're in more control. It gives you more control.
Yeah, it definitely feels like I'm making contact sort of everywhere. Close here.
And this is, what are we trying to achieve here?
Trying to achieve some skin tightening here around the periorbital region.
A non-invasive blepharoplasty
Non-invasive blepharoplasty, indeed.
for those who have a mild but annoying problem of skin laxity and slight fullness.
And then we look to, in the near future here, bring in PRP into the mix, both topically and underneath, and as a filler to fill the tear trough. So both those things. We achieve skin tightening with the Morpheus handpiece, and then some volume fill with our PRP hyaluronic acid mixture.
So microneedling regenerates collagen, but when we use bipolar radio frequency energy, what more do we expect, Dr. Davila?
We expect some degree of, in the deeper tips, some degree of dermal and subdermal injury, and then the more superficial or resurfacing tips, some degree of epidermal injury, and that leads to skin tightening and smoothing of the skin.
I'm ready. Go ahead.
This is the Morpheus Body, which allows for much deeper depth of penetration of the radio frequency energy, and it is the deepest on-market device, deepest microneedling device on market. Is that correct?
Yeah.
And first in Western Pennsylvania.
First in Western Pennsylvania. So you can see that at a maximum depth, the tips are about 7 millimeters long and deliver about energy to about 8 millimeters.
And what are we doing now?
We're going to be doing the inner arm area here. I have to access it a little bit. There we go.
She's too much there. She should be quiet.
Yeah. She should be pretty comfortable because we've put tumescent
No, you're fine.
infiltration in the area. Maybe a few twitches. Here we go.
I can't feel that at all.
Yeah.
Yeah.
That's the joys of
It's
tumescent.
lovely.
That's nice. Oh, I'm happy for her.
And the problem here is some loose skin. We've reduced our arm skin a few months ago, and now the forearm skin needs treatment with the latest technology available, the Morpheus 8 Body.
So it behaves very similarly to the other tips. Feels like a similar amount of pressure.
Yes.
It isn't difficult at all.
So the settings are customized for the patient's presentation, right?
So here, when you're deeper, if you wanted to do a fixed stack, you could.
So a fixed stack would change us to,
And then two pulses, and then
Okay.
lift.
Two pulses.
There you go. Good technique. So you
Now what does this do?
so this delivers 2 pulses of energy, radio frequency energy, per poke.
Which would equal more contraction.
And contraction of the skin, tightening of the skin is
Tightening of
what
the
this is all about.
But less effort and less discomfort for the patient, because there's
You feel
half as many
tingling
pokes.
in your
You
hand?
feel tingling in the hand, right? Not yet. Sometimes people will feel a little bit of tingling.
So when you're doing stacking, you just only one pass. Just put 50% overlap, one pass.
What do you see right now as you're working on her arm?
The same endpoints as microneedling on the face, traditionally used, which is a little bit of pinpoint erythema throughout the area.
So slight redness, maybe a little puffiness, and you know you've done what you need to do. So how long does it take to see a result?
So you have some skin tightening that occurs, can occur a little bit immediately, but really the majority of the results take around 3 months as new collagen is formed underneath the tissues and causes that gradual skin tightening.